Kids Health Watch with Dr. Sang is sponsored by Sang Pediatrics.
So every month we focus on children's health with a local pediatrician, Dr. Nu Sang from Sang Pediatrics in Fresno. Good morning, doctor. Thank
Good morning,
you for being
Jim.
here.
Yeah, thanks for having me.
We're talking about something pretty important that a lot of families have to deal with, and it can be terrifying when it first happens. We're talking about jaundice.
That's right.
With kids.
Yeah, so like a newborn period is very emotional for many
Right.
parents, right? There's super highs and everything's changing, but there's something very stressful that can happen in the first day or two. So I wanted to go on the program and talk to the audience about jaundice and maybe educate everyone so there's less anxiety about it.
That's awesome. So
Yeah.
can you tell us what this is?
So jaundice is just the yellowing of the skin, and the yellowing of the skin is caused by a substance in the blood called bilirubin. And bilirubin naturally lives in our red blood cells. And so sometimes in the newborn period, bilirubin is released into the blood at an abnormal rate because red blood cells, there's a lot of turnover. And sometimes also there are conditions that cause higher jaundice that can actually hurt the baby. So that's what I want to go through today.
So what are those other things that can cause it?
Right, so benign causes such as like just breastfeeding or maybe dehydration can cause increase in jaundice, but there's more harmful effects such as one very common harmful effect is when the mom's blood doesn't match the dad's blood. So say the mom is like an O positive and say the dad is a B positive and the baby ends up being B positive. Mom's blood can attack the baby's blood and actually release bilirubin.
Wow.
And you don't take blood tests when you marry your spouse.
No,
So you,
no.
Yeah. So you don't know all this
Yeah,
stuff.
that's right.
And so all the pediatricians and all the hospitals and nurses, we're all very hyper aware of this. So we're very vigilant in trying to check for all this stuff.
Wow.
Yeah.
And why is a newborn having jaundice? Why is that a concern,
Yeah.
other than the you seeing it, the
Right.
visual?
The worst thing that can happen is actually when bilirubin gets to such a high amount, it can cross into the blood-brain barrier and cause irreversible brain damage. And that's something that every doctor, every nurse, every hospital is kind of scared about because we don't want that to happen to anybody.
Right.
So we're very good at checking for jaundice. In the past, we used to use blood tests all the time to check for jaundice or check for bilirubin. But now we have this device over here, and we have this device at the hospitals and actually at all the St. Pediatrics locations. It's called a bilimeter, and it measures bilirubin through the skin. So I brought Corrine. Thank you, my daughter, for letting me borrow Corrine. So we use the transcutaneous bilirubin meter, and actually checks for jaundice through the skin. We just push it onto the skin just like that. It doesn't hurt at all, right? You just push it 1, 2, 3 times, and it actually will then give us a reading through the skin and let us notify us if it's dangerous or not.
Wow, that's a wonderful device to
That's
have
right.
to use with this.
That's right, and it keeps kids out of the ER. That's what we like to do at St. Pediatrics, is to just use our technology, use our knowledge and skill in order to make sure that the parents are being guided to the right place.
Yeah, and keeping those kids healthy. So,
Yeah.
what are some of the best way to treat jaundice?
Yeah. So, like I said, sometimes something benign like breastfeeding or like the mom's milk hasn't come in yet can cause dehydration. That can cause jaundice. So we just say you can always supplement, right, with formula. Formula is not poison. You can just give a little bit of formula. It'll hydrate the baby, and the baby will get better. You'll notice when the baby is jaundiced that mild jaundice will start on the face or maybe in the eyes, and then it works its way down. So a more severe case of jaundice will be more in the legs. So when it gets to that point, you should be in the hospital. And the hospitals all have phototherapy or light therapy, which is light set to a certain frequency and a certain intensity, so it absorbs into the body, and then it will convert the bilirubin so the baby can pee and poop it out.
Wow.
Yeah, so that's what we do every day.
So
That's
no drugs or chemicals are needed for that, just light?
just light therapy. Unless it gets so severe, we
Yeah.
give blood transfusions, but we won't get into that. That's very rare.
Yeah.
But that's a common treatment we do every day.
Well, this is a good heads up for parents.
Yeah.
If they run across this, they'll know what's going on and what the doctor's doing now.
Right, exactly. And I just want the population to be educated so that just take your mind off one thing
Right.
and just focus on the birth of your child.
Thank you so much. We really appreciate it. Dr.
Sure.
Sang with Sang Pediatrics. We always appreciate when you join. You teach us new things, and we love that.
Thank you.
Now, if you'd like to watch this segment again or find information on how to contact Dr. Sang at one of his 2 Sang Pediatric locations in Fresno, just log on to knph.com. Click the tab labeled Kids Health Watch from the Great Day drop-down menu.